5 key symptoms, 2 common disorders, 1 big misunderstanding. Today, I'm breaking down ADHD and depression to help you understand what's really stealing your focus. Is it ADHD or is it depression? The answer might surprise you. These 2 conditions are more common than you might think, and they're often confused with each other. Why does this matter? Because both ADHD and depression can seriously impact your daily life, affecting everything from work to relationships. But here's the kicker. Getting the wrong diagnosis can lead to ineffective treatment and prolonged suffering. Nearly half of adults with ADHD may show signs of depression, making it easy to mistake one for the other. But don't worry, by the end of this, you'll be able to spot the key differences between ADHD and depression. And who am I to expose the real focus thief? My name is Dr. Sulman Aziz Mirza, triple board certified in adult psychiatry, child and adolescent psychiatry, and addiction medicine. And when I sit down with patients, and almost all the time that I try to figure out if it's ADHD or depression, the answer is... Did you know that nearly half of adults with ADHD also struggle with depression? This overlap isn't just a coincidence. It's a key reason why these 2 conditions are often mistaken for each other, leading to confusion and misdiagnosis. To understand why, let's take a closer look at the core symptoms of ADHD and depression. ADHD is characterized by persistent inattention, hyperactivity, and impulsivity. On the other hand, depression involves prolonged sadness and a loss of interest in activities. At first glance, these might seem quite different, but here's where it gets tricky. Both ADHD and depression can lead to problems with concentration and motivation. This similarity is often what throws people off. For example, someone with ADHD might struggle to focus on tasks due to distractibility, while a person with depression might have trouble concentrating because of intrusive negative thoughts or a lack of energy. Let's imagine 2 college students, Alex and Dan. Both are having trouble keeping up with their coursework. Alex, who has ADHD, finds it hard to stay focused during lectures and often forgets assignment deadlines. Dan, who's dealing with depression, also struggles to pay attention in class, but more so because of a persistent feeling of hopelessness and lack of motivation to engage with the material. From the outside, Alex and Dan's behaviors might look similar. They both may miss assignments, seem distracted in class, and have trouble keeping up with their workload. However, the underlying causes of their struggles are quite different, and where the key differences come into play. ADHD is about a persistent pattern of inattention and impulsivity that has been present since childhood. It's not just about having trouble focusing. It's about an ongoing difficulty in regulating attention and controlling impulses. Depression, on the other hand, involves a more pervasive and consistent low mood that typically lasts for weeks or longer. While it can certainly affect focus and motivation, these symptoms are part of a broader pattern of emotional distress and loss of interest in activities. Another important distinction lies in how these conditions affect mood. People with ADHD often experience mood swings that are triggered by external stressors. These emotional ups and downs can be intense but are usually short-lived. In contrast, the low mood in depression is more persistent and less tied to specific events. It's also worth noting that the difficulty focusing in ADHD is often accompanied by restlessness or hyperactivity. Someone with ADHD might fidget, talk excessively, or feel the need to be constantly busy. Depression, however, is more likely to cause physical and mental sluggishness. Understanding these differences is key because the right diagnosis leads to the right treatment. Treating ADHD when the real issue is depression, or vice versa, can not only be ineffective, but potentially make both conditions worse. So, while the symptoms of ADHD and depression might look similar on the surface, the underlying causes and experiences are quite different. This is why mental health professionals emphasize the importance of a thorough history, particularly focusing on childhood symptoms versus a sudden change in function when making a diagnosis. With both ADHD and depression impacting focus, you might wonder which one is the bigger attention thief. Imagine your focus as a precious jewel. Now, picture ADHD and depression as 2 very different burglars, each with their own unique methods of stealing that jewel away. Let's start by examining how ADHD impacts focus. People with ADHD often experience scattered attention, making it challenging to stay on task. We see this all the time with people being easily distracted by external stimuli, like a notification on their phone, scrolling through social media, or a conversation in the next room. It's not that they can't focus at all, It's more that they struggle to control where their attention goes, which makes it difficult to complete any single task efficiently. Now, let's look at how depression affects focus. Depression often leads to a lack of motivation and mental fog. People with depression might find it hard to concentrate due to intrusive negative thoughts. It's not that they're easily distracted by external factors, it's more that their own mind becomes the distraction. When your mind keeps drifting to negative thoughts, you may feel overwhelmed and lack the mental energy to engage with your work fully. So, who's the real culprit when it comes to stealing focus? The answer isn't as clear-cut as you might think. Both conditions can significantly impact a person's ability to concentrate, but they do so in different ways. Research shows that adults with ADHD are almost 3 times more likely to experience depression than those without ADHD. This overlap can make it even more challenging to pinpoint the root causes of focus issues. Expert insights suggest that the focus issues in ADHD stem from a neurodevelopmental disorder impacting executive functions. These are the mental processes that help us plan, focus attention, remember instructions, and juggle multiple tasks successfully. In contrast, depression is a mood disorder characterized by persistent sadness and loss of interest, which can indirectly affect focus and attention. Another key distinction lies in how these conditions affect a person's ability to engage with tasks. People with ADHD often experience what's called ADHD paralysis, where they feel overwhelmed by tasks and struggle to start or complete them. On the other hand, those with depression may lose interest in activities they once enjoyed, leading to a different kind of difficulty in focusing. One other important difference is in the nature of the focus problems. With ADHD, the issue is often about the inability to control attention. A person with ADHD might hyper-focus on something they find interesting while struggling to pay attention to less engaging tasks. Depression, however, is more about a lack of mental energy to focus on anything at all. It's also worth noting that ADHD symptoms are typically chronic and persistent when untreated, while depressive episodes can come and go. As one expert puts it, the moods run their own course and are unaffected by any attempt to feel better in depression, whereas ADHD symptoms are more consistent over time. What if I told you that addressing one of these conditions could significantly impact your chances of experiencing the other? This unexpected connection opens up new possibilities for prevention and treatment in mental health care. Let's dive into some eye-opening statistics. Worldwide, about 5.2% of children and adolescents have ADHD, while depression affects approximately 8.4% of US adults. These numbers might seem separate, but there's more to the story. For people with ADHD, certain factors increase the risk of developing depression. Being female, having the inattentive type of ADHD, and maternal depression during pregnancy all play a role. It's like a domino effect. One condition can set the stage for another. Interestingly, the mental health of mothers during pregnancy is crucial. Maternal depression has been linked to higher rates of both ADHD and depression in children. This connection highlights the importance of supporting mental health even before a child is born. ADHD itself can pave the way for depression. People with ADHD often face social and academic challenges that can chip away at their self-esteem. Imagine constantly struggling to focus in class or maintain friendships. Over time, these difficulties can lead to feelings of inadequacy and sadness, potentially triggering depression. Here's a startling fact. Children diagnosed with ADHD are about 6 times more likely to develop depression within 1 year of their ADHD diagnosis. This statistic underscores the close relationship between these two conditions. But there's good news too. Proper treatment for ADHD might actually help ward off depression. Studies show that ADHD medication can reduce the risk of developing depression by 20%. It's like hitting 2 birds with 1 stone, managing ADHD symptoms while potentially preventing another mental health condition. The link between ADHD and depression is particularly strong in women. A staggering 68% of women with ADHD are diagnosed with major depression. This high rate suggests that women with ADHD might need extra support and monitoring for depressive symptoms. I did a whole other video about ADHD in women and how much of a problem it is when it's missed, so make sure to check that out via the card above. When ADHD and depression occur together, it's not just about a simple addition of symptoms. The combination can lead to more severe and longer-lasting episodes of depression, especially when ADHD symptoms go untreated. It's like a feedback loop, with each condition potentially making the other one worse. Genetics also play a role in this complex relationship. Family history is a significant factor in the high rates of co-occurrence between ADHD and depression. If you have a close relative with one of these conditions, you might be at higher risk for both. Understanding these risk factors isn't just about knowing the facts, it's about taking action. Early intervention can make a big difference. By recognizing the signs early and getting appropriate treatment, people can potentially prevent or minimize the impact of both ADHD and depression. What if I told you that the medication helping your focus could be deepening your sadness, or vice versa? Let's explore the delicate balance between treating ADHD and depression. When it comes to ADHD treatment, stimulant medications and cognitive behavioral therapy, or CBT, are the go-to options. Stimulants help to improve focus and reduce impulsivity, while CBT teaches strategies to manage the symptoms effectively. On the other hand, depression is typically treated with SSRIs or other types of antidepressant and CBT. Here's where things get tricky. Treating one condition without considering the other can lead to unexpected complications. For example, if you're dealing with both ADHD and depression, taking antidepressants alone might not address your ADHD symptoms. Even worse, some ADHD medications can have side effects that mimic depressive symptoms, potentially making you feel worse. This is why getting an accurate diagnosis is crucial. A professional evaluation can help determine which condition is causing the most significant impairment. The Texas Children's Medication Algorithm Project recommends starting treatment with the disorder that causes the greatest impairment, whether it's ADHD or depression. But what if you're dealing with both conditions? Combining treatments can often yield better results. Research shows that using both medications and CBT can be more effective for treating ADHD and depression than either treatment alone. It's also worth noting that treating one condition can sometimes help with the other. As one expert points out, treating ADHD will often help reduce the stress associated with ADHD, which can help improve mood. And vice versa, treating depression will help improve executive function and motivation difficulties associated with ADHD. However, it's not just about medication and therapy. Lifestyle changes can play a significant role in managing both ADHD and depression. Regular exercise, a balanced diet, and good sleep habits can support your overall mental health and complement other treatments. But remember, while this information is helpful, it's not a substitute for professional advice. Every person's situation is unique, and what works for one might not work for another. That's why it's essential to work closely with a mental health professional to develop a treatment plan tailored to your specific needs. Distinguishing between ADHD and depression can be tricky, but it's crucial for effective treatment. If you've been struggling with focus issues, don't assume you know what's going on. Seek help from a mental health professional to get an accurate diagnosis. Remember, misdiagnosis is common. Many patients with ADHD are incorrectly diagnosed with depression, leading to inappropriate treatments. On average, misdiagnosed ADHD patients may try close to 3 different antidepressants before getting the right diagnosis. Armed with the knowledge from this video, you can be a better advocate for your own mental health. When you visit a professional, share your symptoms, their impact on your daily life, and any concerns about ADHD or depression. A comprehensive evaluation is key to distinguishing between these two conditions. Thank you for watching, and if you learned something from this, make sure to share with friends and family. Hit that like button, subscribe, and let me know in the comments below if you've been one of the countless people that have been misdiagnosed with ADHD or depression and have had issues with your focus, and let me know what ended up working best for you. Until next time, be safe and be well.